Good morning and welcome to Research Over Coffee. I'd like to start by acknowledging that we are in Mi'kma'ki, the unceded and ancestral territory of the Mi'kmaq people. We are all treaty people. We also acknowledge the histories, contributions, and legacies of the African Nova Scotian people and communities who've been here for over 400 years. I'm Dr. Alice Aiken, the Vice President for Research and Innovation at Dalhousie University. Our intent with this series is to profile the scope and scale of research expertise housed in our province and to facilitate connections between the people tackling Nova Scotia's greatest opportunities and the experts working at the forefront of these areas. I'm pleased to introduce today's guest, Dr. Debra Gilin. This morning, in addition to discussing the health risks and workplace symptoms of burnout, Dr. Gilin will discuss how leaders can help combat the ongoing international burnout epidemic by using new research and interventions that work, many focused on supportive leadership. She's an expert in industrial and organizational psychology who's been researching high-stress work environments, team conflict, empathy, and job burnout for over 20 years. Dr. Gilin and her collaborator, Dr. Dana Lee Bagley, run the Psychological Health and Safety Lab at St. Mary's University, where they've been developing successful leadership-focused burnout recovery interventions. After Debra's presentation, we'll be taking questions using the Q&A function of this webinar. You'll see that at the bottom of your screen, and the questions will be moderated by Stefan Leslie, the CEO of Research Nova Scotia. I will now turn it over to Dr. Gilin. Debra.
Thank you. I'm going to share my screen. And thanks for that lovely introduction. Okay. So yes, we're going to talk about job burnout, what it is, why we should care, and how we can address it. And spoiler alert, it is often the case that some of the best things in life are free. Sometimes supportive leadership skills, control over job stressors, and finding ways to make sure that the joyful parts of one's work are at the forefront can really do a lot to address and combat burnout. And we'll talk about other innovative and new practices that seem to be working as well. So first of all, what is job burnout and why do we care? I like to start by suggesting to you that burnout is not a worker problem, it is a societal problem. We can collectively beat it in Nova Scotia, and doing so will help move the economy forward. And we have creative and competitive human resource practices that help us do that so that we can make our province a place that attracts and retains top talent. So job burnout is something that we colloquially talk about and casually talk about differently than what the construct actually is. So we tend to, at the end of a difficult day, we might say we're burned out, but actually job burnout is a serious psychological syndrome that takes months or years to develop. And it goes through a progression. So we tend to first see emotional exhaustion develop, where employees are withdrawn and they have a lot of negative affect. A lot of bad feelings, including hostility, can come up. If not addressed, it can progress to what we call depersonalization or cynicism, but really it means a numbness or a withdrawal from those who you serve. So students for teachers, patients for nurses and doctors. And if not addressed, then the end stage of job burnout is called reduced professional efficacy. So at the last stage, we actually see that job performance is impacted. And especially with people who have a strong sense of calling, that happens when they themselves almost can't function anymore. So the good news about how serious and long-term it takes to develop job burnout is that there's a lot of time to intervene. So if we take a step back, I called this talk the epidemic after the pandemic. COVID impacted burnout levels where they were already critical in frontline workers and raised them in non-critical jobs, so non-frontline workers. Among frontline workers, we know that before the pandemic started, 50% of healthcare and first responders already had elevated burnout symptoms. And then by the peak of the pandemic, before things started to ease off at work, their symptoms had gone up 50% from where they were at the beginning. And contrary to the myth that we had it easy in Nova Scotia, we had it different. in Nova Scotia. So we surveyed a broad section on our team of Nova Scotian frontline workers for the first 6 months of the pandemic, and their mean levels of burnout symptoms were no lower than those in other parts of Canada, like Ontario, with high case counts, or in the US, where there were high case counts and death rates. But it was things like availability of PPE, redeployment to other units, and sort of waiting for battle. As you can see from this respiratory therapist, a calm before the storm phase, that lasted a long time. And the moral distress of seeing patients wait for routine or preventive care and knowing what that would bring later was a unique source of stress. And lastly, isolation for long periods of time, loss of income. Those were our burdens in Nova Scotia. They were just different. If we step outside of the healthcare and first responder world, what we saw is that COVID taught us some new things for non-frontline workers. We saw that people who were managers in particular, who were trying to help people, but remotely now, and support them, had 53% elevated burnout. They didn't start off as poorly as our frontline workers did in terms of their energy levels, but they did have an escalation of burnout. Isolation was a big part of that, and it disproportionately impacted women. So there was this term, this she session, that was applied to this this phenomenon that the International Monetary Fund documented, which is that particularly low education women who have young children were disproportionately leaving the workforce, and the result was a escalation of the gender pay gap for those individuals. The silver lining to this cloud is that we also learned in the pandemic about the power of introverts. So we learned that people of different personality types have more to contribute with varied work arrangements than we realized before we had to go into hybrid and remote work. So why do we care about job burnout? There's both a human case you can make and an economic case that you can make. In terms of the human case and just wanting people in our province and their families to be well, because of the length of time that it takes burnout to develop to a point where someone can't function anymore, there's a lot of space to intervene, but that's a lot of physiological stress response, and those pathways create preventable illness. So things like type 2 diabetes, heart disease, hospitalizations increase once someone has reached burnout. Those become more likely. And there's also a cognitive issue where people become a bit foggy in their thinking. We see medical errors of healthcare workers escalate once they've reached burnout. And we see things like vehicle accidents and even suicide increase because decision-making becomes less sharp for burned out individuals. So that's the human case. We can also make a business or economic case. Once you have burned out workers, they're much more likely to be absent, which is a cost to organizations and society in general. If they do come to work, they might show presenteeism. If you don't know that term, that's showing up physically, but mentally and emotionally being as little there as you could. Sometimes we call this quiet quitting, and it definitely results in poor performance. Those thinking issues I was talking about also mean that innovation is lower, creativity is lower, so our workforce is thriving. They don't have the energy to thrive when they're burned out. The final bill for having one employee who's reached burnout, by the Harvard Business Review, we have an estimate that for every $10,000 of salary you spend, you're losing about $3,400 of it on a burned out employee. That's their low productivity, low innovation. And we've had something of a crisis of nurses, of not having a full staff of nurses at various hospitals in Nova Scotia in the past year. And so once those burned out employees leave, it's sort of a vicious cycle because it costs 1/2 to 2 times their salary to replace them, more in certain critical industries. And so the remaining staff have much more burden, and you have a vicious cycle. So we know from 20 years of occupational health research that there are 6 preventable causes of job burnout that have to do with how we lead people, how we support them. And they are sheer quantity of work overload, number 1. Number 2, a lack of control or autonomy. 3, insufficient rewards or rewards that people don't inherently value. a breakdown in the community of the workplace. So this has to do with peer and leader support, conflict, and toxic behavior. Unfair policies and decisions erode trust. And last but not least, the alignment of values is a resource we often don't tap between employee, what they value and what their workplace allows them to express. And we'll talk about that. So I'm going to talk about, since they're all preventable, I'm going to talk briefly about what are some of the tools that we currently have evidence for working to counteract each of these 6 causes of burnout. And then we'll take a few take-home points and we can move on to have more of a discussion. So the first and most important thing is workload. So you can only withdraw so much from the energy level of your employees before you at the end of the day, you have to remain in the black over the long term. So equitable workload refers to, do you have enough people to do the job correctly? And is it equitably distributed based on ability, position, compensation, et cetera? There's this idea of, it's down here somewhere, spoons, the spoons theory, which just basically says, like, you've only got so many spoons of energy in a day. So when you have a deadline, you can borrow a couple spoons from the next few days, as long as on the weekend you recover. But over the long term, just like iron deficiency is sort of a silent and long-term depletion, so is the depletion that comes from overworking your people for a long time. Eventually, they crash when they reach burnout. Related to that, one of the most universally helpful things is to be able to psychologically detach or totally turn off from your work for some amount of time every couple of days, depending on how your shifts work. That's something that's particularly hard in our modern world of text, of being always available and working remotely, where sometimes we compensate by saying we're always available, which means that you're always using some of those spoons in the back of your mind. We need, or one thing that can help, so innovative tools for managing workload include easy metrics to track workforce burnout. And there's been some capitalization on the remote workforce that we learned during COVID that we can harness in Nova Scotia. One of those is actually something that our team is doing, which is developing workforce burnout apps that can both track burnout of a workforce if they sign on. So a leader can see the temperature of the group, or their peers can see that. And also, if you think about all those little 2 minutes during the day where maybe some of us scroll on our phones too much or watch cat videos, in those moments, one could use the app instead to be learning how to recover and refill, get back in the black to recharge before becoming burned out. The second are pulse tools, very, very short surveys, essentially, that help us take the temperature of how a workforce is doing. Some people at St. Mary's are experimenting with doing this for facilities and construction workers, much like you might have seen those buttons in the bathrooms at Pearson Airport that you can kind of smile or frown on the state of the bathroom. Similarly, you can smile or frown on the state of safety in a safety-sensitive workplace or the state of your burnout. And it allows us to, because we have space to intervene with burnout, it allows us to see if the workforce is becoming depleted. We've had some good experiments with those. The second issue of control, I like to use with job control, I like to use the analogy of powerlifting, because job control is actually the antidote to workload, and it can help us carry more workload without becoming more stressed out. So in this picture, you see a power lifter, the big barbell is her workload, and job control is like her inherent strength. If you have the job control to perhaps take your mother to their doctor appointment in the middle of the day and still get your work done before and after because you have a flexible work arrangement, you got more done for society that day, and you are possibly less burned out than a day at the office. So control is the antidote. It's often free and it's not always appropriate. Nurses can't work remotely, for example, but it often is. And it's a competitive advantage that we can offer to attract people to Nova Scotia. Millennials and Gen Z workers in particular learned in the pandemic that they like walking their dog at lunchtime or working in the garden. And that's now a somewhat free factor that can attract and retain people. We have a lot of capacity to be a hub of the tech industry in Nova Scotia, and harnessing the remote workforce correctly is something that will help retain those people to our province. Secondly, just to point out that work-life balance is completely unique. Dictating that employees should stop sending emails at 6 p.m. is not facilitating work-life balance. For example, you could have young parents who prefer to pick up their kids from daycare at 3:30, spend that precious time until the kids are ready to go to bed at 7, and then do some quiet work in the evening, or take a couple calls in the evening once they're asleep. That might not look traditionally like work-life balance, but it is. It all depends on what's in one's life that they're trying to balance. Number 3, rewards. So this has to do with providing rewards that employees actually want. Salary matters. Money buys choices in life. But once you have a fair and reasonably comparable base salary to other jurisdictions, considering your cost of living, it's more efficient to put money into performance bonuses. It's sort of a win-win. So you only pay it as the organization if your goals are met. And it is quite motivating to a lot of employees, as long as they have a safe salary base. Beyond money, a lot of the rewards are honey that you can use to attract and retain top talent, rather than vinegar, so to speak. And I've put a picture here of one of my favorite businesses in Port Williams, the Wooden Hive Natural Honey organization, as just a reminder that these what non-tangibles can you offer? I recruit and try to retain graduate students from provinces further west to Nova Scotia all the time in our graduate programs. Nova Scotia has a lot to offer a particular type of person who's outdoorsy, who loves the ocean, maybe who wants to live somewhere beautiful and quieter than, say, Toronto. And remember that the amount of joy you can allow someone to keep in their life, amount of calling and purpose to their work by crafting the tasks to their interests, allowing time with family, these are precious gifts, and people recognize that it's something that you're offering that's a non-monetary reward. The fourth is to work on avoiding breakdowns in community, or said more positively, building community. So how can we build capacity or policies for leader and peer support for employees to help fill the bank and recharge their batteries before they get to burnout? I have 2 suggestions and tools that are evidence-based from my own work. The first one are evidence-based conflict supports. So the idea here is that you give phased options in increasing levels of formality that can build the capacity for people to deal with personality conflicts or even bullying and harassment before it widens in its circle of toxicity. And secondly, we've been putting together and testing 6-week courses that provide training and coaching for leaders on a skill set that often they weren't trained in to get to their level of expertise, their technical, they were maybe promoted as an engineer because of their technical prowess, but they might not have ever received training on how to be a supportive and empathic leader. When we asked Nova Scotian burned out employees what they need, this is the top category, was that they need resources, they need flexibility, and they need personal support and empathy from the people that they work with. So we do have some evidence that this can work. So you see some of the program names that we've developed in our team at the bottom there. And this is just one of our recently published results on those courses that we published in the Mayo Clinic Innovation Journal. So what you see in the big green bar is that we had leaders of organizations in healthcare wear Fitbits as they went through training to learn how to recharge their batteries, how to focus on aligning their values with their work, and how to be a supportive and empathic leader and improve their conflict skills. And what we found is that their resting heart rate during sleep, the bar on the left, went down on average about 3 beats per minute, which may sound somewhat modest, but that's an average, and that's actually enough to be health relevant. And you can't fake it. Their self-reported burnout also went down, but you can't really argue with the resting heart rate. The other 2 bars show comparators with studies that either changed the work restructured the work to make it less stressful, or the bar on the far right worked with employees on their physical activity levels. And you see that compared to those interventions, ours was having a larger effect. So we think there's a lot of opportunity there. Fifth, correcting unfair policies and giving real voice. I can't tell you how many times I've heard from employees about what I would call false voice opportunities. So this, for example, is when you hold a town hall about a decision that's already been made at a top level of the organization to give people a chance to complain to you. It tends to brew bad blood, and it doesn't actually allow voice. Voice would be to have that town hall when you are looking for input on how to proceed or what would be the most acceptable way to solve a problem to your people. Secondly, we use fair policies and real voice to help contain the inevitable toxicity of difficult people. I would say out of the workplaces I've worked with over the years, 1 out of 10 or 15 employees universally is considered to be difficult. They account for a higher proportion of the conflict in the workplace, but they also bring a divergent perspective. And we know that organizations innovate better and make better decisions with a divergence of perspectives. So the key is to contain the possible toxic spill that happens from these individuals. And there are known evidence-based communication techniques we can train leaders on to help push them in that direction. And we know from the research literature, you want to manage 3 basic areas of perceived unfairness in your people: how rewards are distributed, what are the processes for rewards and decisions, and how transparent is information flow. That was especially important during COVID, where things were changing from day to day, or anytime you're in something of a crisis moment. And last but not least, values, values, values. So this has to do not with just one set of values being objectively good, but rather the fit between employee and workplace values. So there's 2 ways you can increase that. One is by actually using valid selection procedures to assess the fit in the personal values, what drives their calling to their work or what they want in their life, and the organization's values. So this is something that your friendly neighborhood industrial organizational psychologists specialize in. Our job is to help put round pegs in round holes. So are you a square peg? We find that fit is important. It's not just about being competent, but fitting the culture. Secondly, if there's not the ideal amount of fit, you can also engage in job crafting with employees where collective agreements allow. So this is changing the job to fit the things that are most enjoyable and that the person is best at. This is the equivalent of you and your spouse choosing to divide up the cooking versus the cleaning based on what you actually enjoy and are good at rather than what's equal. So a few take-home points, and then interested to have a discussion about questions. Burnout is a societal problem, not a worker problem, and it's a serious one that leads to really significant changes in people's wellness. Secondly, it is a short-term solution that backfires to constantly deplete or overwork the workforce and have people be in understaffing situations. It creates a vicious cycle and a downward cycle for a province. And lastly, workers really need a set of resources that allow them to handle workload. And those resources are autonomy, voice, opportunities to learn and develop their skills or job craft, and interpersonal support from those that they work with to retain their health and wellness. So the last 2 slides that I didn't start with because they sound touchy-feely, but are actually true, is that joy and meaning in the work that you have and finding ways to preserve the reasons you were called to a line of work, and then refinding joy in all the other aspects of your life is more important to prevent and recharge and intervene before people get to burnout. Once they get to burnout, they need to completely stop working until they completely recover. But we can prevent that from happening for many people with smart human resource practices. And supportive leadership is surprisingly powerful as a tool. Oh, good time to find a typo. So these are my wonderful faculty and graduate student collaborators on all of this work. And I thank them immensely, as well as Research Nova Scotia, for this opportunity to chat. And St. Mary's and Dalhousie have also supported this work. So Thank you.
Thanks, Deborah. So I'm Stefan Leslie. I'm the CEO of Research Nova Scotia. I'll be helping out with the Q&A section of the session part of this session. So we have about almost 20 minutes for conversation. Any of the participants online, there's a Q&A button at the bottom of your screen. So if you have any questions for Deborah, then just pop them in there and I'll manage the discussion. But I'll get things started. Just a couple of things that I heard in your presentation that I thought might be interesting to follow up on. And the first one relates to the extract or the quote from I think it was a speech therapist or something. I can't remember exactly. During the pandemic, this person talked about not just stress now, but what was anticipated, the sort of calm before the storm. Can you speak to how this works with respect to what you're experiencing in the workforce now, but also what you expect to happen and what that may mean as we continue through, pandemic or post-pandemic, whatever we are in, how you see the trajectory of this going, getting better, getting worse, or just getting more complicated?
Yeah, well, that's really interesting. I haven't thought about that before exactly in that way. So thank you. I think that we're moving into a place in the workforce where uncertainty is more common, actually. So the golden handcuffs and the pension are no longer, as we see more of a gig-based economy. So what I don't know is how is that impacting the younger generation? So our millennials and Gen Z workers, maybe they're just used to it. So I'm not sure if you're familiar, but there's actually a phenomenon of Gen Z people getting married earlier and having children more in their early 20s, like used to be back in the day. It's a new phenomenon. And the reason is they're like, we're not going to be able to afford a down payment. Let's just move on with our lives. So generationally, we might see that they're more resilient to uncertainty. Whereas the quote was from a respiratory therapist, and it was this idea of, like, I called it waiting for battle, that happened as we were, the uncertainty level at the beginning of COVID was for sure truly unprecedented. So I think that if you expect a crisis to be coming and it's coming down the line, we may have budget cuts, we may need to lay off the workforce. It's probably that same level that nurse was experiencing. But we also, on a day-to-day basis, I think there might be generational differences, and our younger generations might be more robust to that uncertainty.
And would it also possibly be the case that the way we've organized society, or the way society has come to be organized, that certain groups would have more reason to be confident in the future and some less? And so at the individual level, you may be more robust or less robust to the kind of stress that leads to burnout, but we've kind of pre-positioned people perhaps to give them the chance that may be better or worse.
That's interesting. So the pre-position part I need to think about for a minute, but we know that there's dispositional tendencies to sort of perceive threat as a bigger bear in the room, so to speak. So there's differences in people's brains in terms of how responsive to stress and how anxious they are. And we see this a lot. We work with people to help them boost their personal styles and understand their strengths and weaknesses in some of these courses. And we can identify a profile. It's actually an empathic profile, but that is threat attuned. We call it a personal distress responder. So that type of individual is at a markedly higher risk of burnout if they go into the helping professions. And they often do. So that's kind of a vocational preparation. There are interventions we can do to inoculate people and help them with special supports. In terms of setting people up almost to fail or not giving them the chance there, I haven't thought about that as much. I think that as a society, we've become more aware that people of different groups, people who are maybe neurodivergent or who are of groups that were traditionally discriminated against, probably enter these situations with their threat sensors up more. Mm-hmm. And I'm hoping that we're coming up with some innovative ways to, over time, correct that. But it remains to be seen.
Yeah. So in your presentation, you spoke to things that individuals can do, which would be very personal to their individual circumstances and preferences, workplace, and so on.
Yep.
Then there are things that a workplace may be able to do, and it'd be different if you're running a roofing operation as an office, what you're able to do. But then there's also the policy side, and you didn't spend as much time talking about that. So if you could maybe just reflect on important things at the individual level for their circumstances, the employer, but then perhaps focus a little bit more on where you see the policy direction that can provide perhaps both the individuals and organizations with better tools to manage this, or to somehow change the environment to reduce the impact of this.
Right. And so that is where I can be a bit ivory tower, in the sense that I don't work in that space very often. And I'm interested in what some of our listeners might ask or contribute. But broad strokes, it's often quite simple. So what policies would actually allow nurses to have sufficient colleagues on staff that they get to take lunches, that they eat and hydrate, when, like, it's so simple. We've worked with a lot of nurses and doctors, and they don't have a chance to eat lunch. They don't get to the washroom. They can't text back their kid who had a question from school. So at a base, so it's almost like, if you think about the old, like, Maslow's hierarchy of needs, if you ever ran into that, took an intro psych class, like, actually policy needs to start with the base. Like, people have to be able to be not in a panic mode because of the level of emergency understaffing that's happening. And they need flexible options for recovering. People are really smart. They can find ways to find pockets of recovery with a little bit more flexibility, rather than a top-down micromanaging approach. The other piece around policy that we talk about in my lab, but again, I'm not an expert, is just what are the metrics that are actually rewarded of our public organizations, right? Because that's what upper and middle management have to have their eye on if they want to remain viable. But often those metrics, what we're asking are like, how many beds were full? What was the wait time? It's not that that's not important. Wait time is important, but often we're focused so much on just these metrics that policy drives, and they're not always the right metrics. It's not always about quality of care. You wouldn't have to be sitting waiting for an ER doctor if you had a family doctor, things like that. So often it's, I think, actually reviewing what are the metrics that are setting up the contingencies that that flip what things we're focusing on, rather than human energy being preserved so we can thrive, So that's my all over the map answer.
Okay, it's part of the fun of all this. You get to have a expansive thinking and talking about it. You mentioned early on that it progresses. It starts and over a period of months to years, I think is what you said. So for those who perhaps are maybe in the earlier stages, mechanisms or tips to reverse or stop or arrest or slow that progress, because I think job stress is going to be common, but how do you prevent that from then moving into the next stage, in particular in an environment where a lot of workplaces they may not be reverting completely back to pre-pandemic, but they are shifting again in their expectations around how often you show up and the degree of flexibility. So those two dynamics, can you speak to how that might operate?
Yeah, I was so interested in listening to your question that I already forgot the first part of it.
The first part was, since it's a progression, if there are ways that to keep things from moving along.
Yeah. So I like to use the analogy of iron deficiency. Like, the slow drain over time, there's lots of chance to intervene, but when it gets to a critical level, it can be fatal. Like, you could actually die of an iron deficiency, right? So burnout's the same. So what we do is we actually help people map. So the way that you go from work stress to burnout over, yes, months or years, looks very individual. So we help people to map what that looks like for them, and to come up with a few kind of bench or guideposts that for you, for Stefan, or for me, for Debra, that's a sign that I'm getting to a level of overwhelm that would then quickly escalate to burnout from that point forward. And that's like a stop everything, cancel things that are optional, don't say yes to new stuff, find a way, let your family and friends know that you need some space to recharge, or connect with them if that helps. But like, that's the critical moment. We call it the orange zone, from like going from green to red. You're not going to take a work leave, and you could still turn things around. And so we help people develop basically an intervention plan. Like, one of my guideposts, this will sound really silly, is I start leaving my purse all over Halifax Regional Municipality or my phone. It's because of the cognitive impact of being overwhelmed, and that's just how it presents for me. So so it's very individual, but if you can identify what are kind of the warning flags that you're in a state of overwhelm or emotional reactivity that's really unhealthy, then you need an individual recovery plan as well. But it almost always has to do with leveraging flexibility, temporarily reducing demands. And this is why I like that spoons theory. Like, you're always going to pay the piper at the end of the day. So if you're taking away, if you're overburdening employees, it's going to result in paying twice their salary to replace them. It's like, it's way better to keep them in the thriving zone and to support them in doing that. And I don't think I answered the second part of your question.
That's okay. Because I'll build on what you said. So first of all, it was a very individualized response because we're all different and we're doing different jobs and our needs and aspirations are different. So that makes sense. So, but before I go into the second part, is identifying those kind of milestones or trigger points, or, lose your keys around the house, whatever it is that something people can do on their own, or do they need help to be able to identify those?
Right. So we think they need a little help because and the good news is this isn't rocket science. I've watched some of these talks that are, but this is something that with a little bit of information and effort, most people can actually do. So I think that's why where we see the resting heart rate response from a 6-week course where we met with people and they had a little coaching. But we've developed an app. It's called the ImpactMe app, and it's just in pilot testing right now. And it's something you can have right on your phone that helps you in those little downtimes in the day, figure out, like, map your own guideposts, figure out what recharges you. So a simple nugget is that there's a lot of things people do because they think they should. I should walk. Walking is healthy. But what actually recharges when you're in that orange zone are things that give you joy and energy. And you've got to pay attention to, we should ourselves a fair bit. We're all, good soldiers. But not all of us like going for walks. So it's actually noticing what things energize you and building in and protecting those, because sure, you need rest, but actually that feeds the meter and helps people go from just like surviving to thriving. So it's really noticing, what energizes you in your job and outside your job.
And the second part of the question was really reflecting on some of the changes we're seeing in lots of workplaces, not reverting to pre-pandemic, but maybe compromising on some of the flexibilities that were provided when couldn't come to workplace, and what that means for the ability to manage burnout or arrest that progression.
Yep. So I'm going to say something maybe unpopular, which is that, like, if the reason people are being called back is because we're paying rent on buildings, pay less rent on buildings, like switch it up. Because I think that Nova Scotia has a great power to attract and retain young talent from globally and in Canada. But this is what the young generations want. It is a compensable factor, essentially. It's basically money to them. It's more than money. And so you could save costs and provide a work environment that attracts the best people. But so I think it's something of a force of habit where it's like, well, we've been losing money on these buildings that are sitting empty, so make people come back. No, maybe think about losing a building. So
to me, that it almost speaks to a lack of imagination on the employer side to be able to envision what a workplace that is more supportive might look like and how it can function just as productively as before.
Sure. And the part that I do fully understand, and I think that we don't understand yet, is how do you maintain culture when you have people that are physically dispersed, pardon me. So I think, for example, I've always loved working for St. Mary's. It's a very family place, and it's been a wonderful place for me. We're currently sailing on our good culture that we created in the past. But by what small little pieces does it break down? Like, at some point you have a phantom of a good culture, but do you actually know, like, what's going on with your supposedly close colleague anymore? Could you actually support them? So that's the space that's a question mark, is how does culture get maintained in these dispersed situations? And that's a legitimate concern that I think that's a really legitimate concern, and we don't know the answer yet.
So what, in your observation and the research you've done, biggest misconceptions? Maybe there's two different perspectives, like misperceptions among the workforce and among the employers in this area.
Yeah. Well, one of my favorite misconceptions, so I'll start there, is I always, my collaborator Dana and I always say, like, when we come to your organization, we're not going to tell you to do more yoga. So the idea that there's these universal things that if you just add them to your already packed to-do list, they will magically help the individual solve a societal problem is a myth. So that sure, I may like yoga and that may be something that gives me joy, but it is not like lunchtime yoga. Spending money and time and forcing people to go to lunchtime yoga is not the answer, right? So I think that that's a misconception, maybe more on the organizational side of things, is that it's the workers' burden to fix it. Now they have it. We all, the empowering piece and the stuff we do is, if you're in a bad situation, there are still things you can do to cope with it better. But the organization should be trying to create a situation that lets people use their intelligence to get the most energy out of their abilities. And I think with workers or employees, I think on some level, we did get a little spoiled in the pandemic, and there might be real reasons that we need to go and work in the office sometimes so we can collaborate with others, so that we can answer questions and be a colleague. So it's not complete. I think sometimes there's a complete, I do my job 100% just as well being at home all the time. I never need to go in the office is probably for many people not quite accurate. Should they be able to be home and balance things? Yes, but there's costs and we don't totally know what they are yet. And there's invisible parts of the job that aren't being done. So I guess to try to provide a balanced perspective, you don't just need to give people yoga, and it's maybe you're not doing your job 100% the same when you're 100% remote.
Has the nature of work overall changed in such a way that burnout is going to be something that needs to be managed in perpetuity?
Yes, I think so. I don't see it going a different direction. How we manage it, I've been finding, I think that the tools keep changing, right? So I was speaking with some artists on the weekend who no longer think it's productive to sit down and write all their arts grants from scratch. They're using AI tools to help them do that more effectively, right? But a lot of these tools, they make us more effective, which actually just means there's more that we can do. And the ubiquity of communication tools and the possibility that work is always there, especially for home workers or remote workers, means that it's actually managing the burnout piece is as relevant or more as when people punched out physically and left work. So it actually needs thoughtful management, I would say, in our modern world in a brand new way, so that people can maintain the boundaries that they need between their work and their other lives.
Just going to squeeze in one more question. Is in what you have in the surveying you've done and the work you've done, if you've come across one thing that someone's tried that was really kind of unusual and interesting, but really proved to be quite effective, that maybe those in the audience might not have thought of and thought, oh, that's kind of an interesting one. So yeah, it's personal, but how creative can we be here?
Yeah. Okay, that's a good question. I'm trying to think of like what would be something really innovative. And honestly, the iPads on stands at the construction work site where you just hit that was with safety, how adherent to safety were they being, but we picture doing that with burnout to take the temperature of a workforce, is pretty innovative. So the bathrooms at Pearson, there's something to that. So taking the pulse and getting information seems to be something that we could leverage more within workplaces. And it's not at all creative, and so we overlook it. One of the most powerful things are workplaces that found a way to provide connection, like peer support and leader support and communication during the pandemic. So for example, home care nursing teams who just began starting every day with a good old-fashioned conference call of everyone for 15 minutes. How are you doing? Here's when we're getting more masks. Anybody got an urgent issue, hugely supportive to people and costs almost nothing. But yeah, people want to connect and they want to be supported with their team. They long for that.
Great. Well, I could ask lots more questions, but we're out of time. In fact, we're over time. So thanks to the audience who've stuck with us. So again, Debra, thanks very much. And thanks also to Alice, my co-host at Dalhousie, for putting this together for us. Thanks very much, everyone.